Good morning, everyone, and welcome to the webinar. Today, we're joined by our friend and colleague, Jared Wasley of Oscar. He'll be doing the 2023 open enrollment preview. So glad to have him on board today. Things are really heating up. Things are coming out. All the information for OEP is starting to finally drop, and Jared's got full deck that he wants to roll through with you today. Just some housekeeping. If you have a question, type it in the question box. If you have any questions, we'll get to those at the end of the presentation. Cornerstone, connect with Cornerstone. Follow us on social media. Subscribe to our weekly Monday Minute newsletter for the latest Cornerstone carrier and industry updates. And by all means, if you have a question about anything related to the individual market, give us a call. There's my phone number. Eric, who's also on this call, serves in the same role. There's his phone number and email address. Doing a ton of stuff right now on behalf of our brokers. You guys are the best in the industry. We do everything we can to get you ready to sell. As a Cornerstone broker, you have access to expert services from our agency services program that can help you with business outside of your scope and planning for the future. We create a customized plan for you based on your specific needs to ensure that you, your business, and your family are covered. Contact us today about the program. Okay. Referral, succession planning, and retirement assistance. From the downloadable social media images to customizable flyers, Cornerstone's Marketing Hub has what you need to start managing your marketing in-house. You can access the Marketing Hub through the Cornerstone Resource Center with your username and password. Please contact Jess Larkin with any questions. Her email is jlarkin@crnstone.com. Give her a shout. Okay, Jared, you can hear me loud and clear, I hope?
Yes.
Fantastic. I'm going to make you the presenter. And
great stuff. Thank you, Geoff. You should be seeing my slides. Morning, everyone.
I do.
Okay, great. Morning, everyone. Thank you for the intro, Geoff. Appreciate you hosting as well for us. Really appreciate being given the time pre-open enrollment, and we are looking forward to another interesting open enrollment. I'm sure we can all expect. My name, as Geoff mentioned, I'm Jared Wasley. I'm a senior market development executive at Oscar. I cover the Northeast region. At least it's our version of the Northeast, so Ohio falls under my purview overall. I'm going to start with some Cleveland Clinic slides, which we would usually have a presenter from Cleveland Clinic available, but they're kind of difficult to find. But I know just enough to get myself into trouble here on these. So giving you some Cleveland Clinic updates, just since we do have that joint venture with them in Northeast Ohio overall. First of all, we understand in terms of their overall kind of ranking, one of the best systems in the country, never mind just for Ohio or the Midwest itself. Massive partner that we're able to have, and we've joined with them for a number of years now. A lot of people also ask us what the relationship is like. It's not actually really a network partnership. It's actually a joint venture. So a network partnership, usually a carrier would go in, they'd negotiate rates, they would speak about a few other things. This was actually one where we met with them, and we have kind of a 50-50 sort of partnership in the sense of what we market, the plans we design, how we kind of align ourselves in the market as well. So everyone kind of has a little bit in the say. Obviously, we don't touch on the clinical side, but it's very, very much an integrated process overall. As we've presented a few times, they have the #1 heart program in the US for 28 years in a row. And pick a specialty, they're basically in the top 10, if not the top 15 for almost all of the top rankings for specialists. So very, very impressive overall, and really needs no introduction, but always kind of a nice plug, especially for people asking, why is this a premium network? What am I getting for my money, so to speak? And it's more than sort of just the name or the brand itself. They also operate an integrated care model, which again aligns really well with us. So they kind of have everything kind of embedded into their own system. There's access and transparency throughout. They are incredibly good at proactive care coordination as well, and kind of the gold standard of that. And that's just essentially making sure that patients are finding the right care, the right specialist, the right location, and kind of following them throughout that full journey, so to speak, that a member would go through with the Cleveland Clinic. From an expansion point of view, there are a number of expansions in the works as well. So Mentor Hospital, that's opening early next year in Lake County as well. So that's inpatient, outpatient care as well. So I mean, this is fantastic for a company like Oscar, where they already have quite a broad access overall, but making sure that geographically they're covering more of the service area as well, which, as we know, having access to in and outpatient care, PCPs, all those kinds of things just makes this experience better overall. There's also a Middleburg Heights Family Health Center. If I remember correctly, this used to be, I want to say it was like a Walmart or some other large box store. So this is opening in midsummer 2023. This is more of an outpatient and primary care, very much needed as well. So pretty great that they'll have that lab and imaging as well as a pharmacy as well. So pretty excited for that overall. And then the Neurological Institute, somewhat more down the line, but that'll be on the main campus of Cleveland Clinic, opening in 2026. Of course, that usually handles inpatient, outpatient care, the surgical side, imaging, and research as well. So a pretty colossal add there overall. And then the Cole Eye Institute, which is in 2025. So that's, of course, mostly around ophthalmology, those types of things, in and outpatient as well, again, on Cleveland Clinic's main campus. So great expansion on the main campus itself in the future, but in the near term, we have those two main sort of in and outpatient circles that are being added to the network as well. I won't go too much into this, but I just want to touch base in regards to their network navigation. So as many of you know, they actually have their own virtual urgent care. So Oscar itself has our own virtual urgent care, but specifically for Northeast Ohio, we utilize their virtual urgent care, and members will have access to that as well. So again, this is kind of like a use case of, patient story where something went wrong. And essentially, they use that care navigation to fix this. So I think that really aligns quite nicely with the Oscar ethos overall, being really engaged with the member overall. And I think that's incredibly important. And that's kind of a good segue into us and sort of an update on ourselves. We've had the slide last year as well, and we really do combine technology with a member-centric approach. So that's not just using technology just to have a nice app. It's really about driving cost savings and having better member satisfaction. And this approach clearly has actually worked incredibly well for us. So just kind of in retrospect, or just kind of for a history lesson, we launched in 2014 just in New York. We launched a small group product in 2018. But more recently, we've had some massive announcements. So in early 2021, we IPO'd on the New York Stock Exchange. At that stage, we had just over 500,000 members in 18 states. As of December, we have 1 million members. We're in 22 states, and that's 80% year-on-year growth in premium. So just an absolutely massive year for us. And really all thanks goes to folks like yourselves on the call that have allowed us to grow and have trusted us with your business as well to grow so effectively. How things look for next year is we'll be in 20 states. So we will be withdrawing out of Colorado and Arkansas, but overall you'll just kind of see stabilization is kind of the main play for this year. So we're still in nearly 500 counties. Individual is obviously our predominant product line, but we do have an MA and small group product. We have over 2,000 employees spread throughout the country. Our main head office is still in New York. We have a Los Angeles office as well, but we now have employees all over the country. And then 3.4 billion in direct policy premiums. That's as of December 31st as well. So really exciting times overall. So you won't notice any massive growth aspects. We've already sort of had that last year, and we'll look for 2024 for any potential expansion there. What we'll touch briefly in this is just kind of the 4 kind of key tenets of our of what makes us different, essentially. So again, patient-centric networks, kind of working with the Cleveland Clinic, but we also have, you know, great product in Columbus as well. We'll touch on that as a reminder. We have care teams. I think we also are one of the most, if not the most inventive on the plan design side as well. So we'll have some updates there as well. We think that's one of the key ways in which many carriers have missed out on offering the best or sort of as customized a solution as possible. And then of course we have convenient access to in-person care, but virtual care has become incredibly important, and that's something that frankly we've really been at the forefront of for a number of years now. In terms of the broker commission side, the broker commissions, they're going to stay exactly the same as last year. There's no massive adjustment there, so new and renewing will stay consistent there. Happy to answer any questions at the end as well. From the broker support team, I just kind of wanted to plug here just around what this team is for. I often get asked, you know, who should I reach out for, in what situation, etc. So I'm still the contact for new business or any kind of escalated issues that are beyond claims, that don't include medical data, those kinds of things. However, the broker support team is really there for most day-to-day aspects. So for non-essential things, they're at brokers@highoscar.com. Let's think about, you know, maybe making sure that your appointment is correct. Follow up on commissions. And then that 855 number would be there for more time-sensitive matters where you maybe want to, and also that email would be best for terming off exchange members, for example. And then the number is there for more urgent matters. So maybe if you have a quick question that you need to ask them, maybe you want to ask about commissions, but you want to kind of just a straightforward idea of what that is, that 855 number is available for you. So kind of your day-to-day basic service needs, that brokers@highoscar.com email is kind of the go-to. I also highly recommend bookmarking 2 pages, one of which is highoscar.com/brokers. This is going to be your one-stop shop for frankly 90% of things that you might need. So whether it's plan grids, kind of some more extended SBCs, marketing materials are available there. There's also the provider search as well. I'll touch base on that a little bit later, but you can also access that there. And then of course, this is also the entry point for your broker portal as well. So once you log into that broker portal, it's business.highoscar.com, you'll see that. But just make sure that that's also bookmarked, since there's so much self-service that can happen that frankly is honestly the fastest way in many ways in which to service any kind of issues, or even just double check things like making sure that members are showing active once you enroll them, checking on commissions, all that kind of thing. ID cards for members can really be a massive time saver there. In terms of our product portfolio, there's sort of 4 key highlights that we want to touch on. So firstly, you'll see the introduction of standardized plans. So CMS have been speaking about this for some time. So this year is the first time where you'll see standardized plans in a number of markets, including Ohio. So that'll be bronze, 2 bronze, 1 silver, 1 gold. These are actually quite well designed, I must say. It's nice that members can firstly kind of compare like for like. They largely are going to be the best for folks that are getting a decent subsidy. And so you'll see that applied overall. So might become quite a popular plan going forward. There's also a reduction of the plan portfolio. So obviously we've had to add standardized plans, so we didn't want to add to an already very packed list. I'm sure many of you will be happy to hear that. And also just for context, you know, last year we were really expecting a growth year, and we really did have that. We wanted to make sure that we had as many plans as possible to ensure we had no significant gaps. Now that we've gone through that, we can kind of see where membership has moved to, what the preferences were, and so we're reducing any of the membership plans that didn't have significant uptick or membership overall. So you won't see a huge disruption. Most of these will be auto mapped, but again, that's largely just down to making sure that we are offering the best kind of customization as possible. But now we've had to reduce that now once we have that, just to ensure that there's, you know, an easier selling process so members understand, and of course you as brokers can navigate it a little bit easier. Last year we also added enhanced direct enrollment, so we have that powered through Stride. You can actually now enroll members through the Oscar portal on and off exchange. Once you have that set up, it's actually really straightforward. Of course, feel free to use whatever your preference is, but we did have a number of brokers that prefer to kind of manage it all in one place, especially for those who are predominant Oscar producers, or they just like having that as an experience overall. And then you'll remember we also partnered with NatGen for supplemental products. If you're an existing broker, there's no adjustment there whatsoever, but we will continue to offer those supplemental products in most of our states. For plan and benefit spotlights, I wanted to touch on a few things. Now, there are some variations here based on Columbus versus Cleveland, so I've kind of tried to give general viewpoint overall. The one thing is the Bronze Elite plan. So if you remember, this was called the Classic Bronze Next about 2-3 years ago, and essentially was a $0 deductible bronze plan. It's basically a copay plan, but it has bronze pricing. So now it's a Bronze Elite $0. In most states, in most areas, there's a specialist version and there's a PCP version. So obviously you'd use one depending on what most frequently the client would need. But essentially it's for folks that want upfront costs with low PCP, urgent care pricing. They probably don't get a really massive subsidy, but they still want an affordable premium, but like having those copays throughout. And it's going to be really great for those folks who want that. And then at the same time, they don't have specialized RX needs. So we launched that $3 drug list last year that's done incredibly well. This has access to that, so they do have great options on the prescription side. But again, if they're on anything specialized, that wouldn't make sense. But if they aren't, this might be one of the best plans for them, and we've seen this do incredibly well across the country, and we kind of were at the sort of forefront of designing this for those kind of use cases. The other plan is the Silver Simple. So the Silver Simple family is generally one of the more affordable in the Silver tier. So I've just shown the Specialist Saver version here that doesn't include subsidies, but this is going to be, other than those standardized options, probably the best for highly subsidized on-exchange clients. So there's low PCP and urgent care copays. Of course, those copays go down drastically as income gets adjusted. Straightforward deductible. There isn't an RX deductible. There's a copay of labs as well. And again, still having that $3 drug prescription list as well. So you'll see this probably as the chunk of most of your subsidized list overall. Our vendors remain the same as last year. I'll touch on the formulary. We actually built out our own formulary last year, but we continue to use CVS Caremark as the pharmacy vendor. So we used to call them the pharmacy benefit manager. It's really a vendor now. So that's all CVS pharmacies, it's Target, Walmart pharmacies, and thousands of mom and pop throughout the country. Arguably the most, if not one of, if not the most broad pharmacy vendors available. Optum continues to handle our mental health benefits. We offer pediatric vision on our plans. Pediatric dental won't be available next year. It'll be in California only. And then you'll remember last year we added LabCorp as a in-network lab partner. So now you have Quest and LabCorp, basically the two largest lab partners that are available, being included in the network. From a market and network standpoint, things very much the same. So this is largely a reminder. So again, Cleveland Clinic access for Northeast Ohio. Members have to live within one of these service areas, these counties, to have access to this. The one big call out was about 18 months ago. Cleveland Clinic purchased Mercy Medical Center in the sort of southernmost section of our rating area. So that's just that Mercy Medical Center and that facility down there. So you will see that actually branded now as CCF Mercy Medical Center. So that's the most significant add-on we've had there. We had a lot of people asking for that to be included. And so now that is part of the whole sort of Cleveland Clinic plus Oscar ecosystem in Northeast Ohio. We also introduced a dual Columbus network. So just as a reminder, the main network remains the same around Mount Carmel, but now we have a broader option that includes Mount Carmel, Nationwide Children's, and Cleveland Clinic access as well. So how we describe those as choice is the broader of the network. Again, that's Cleveland Clinic, Nationwide Children's, Mount Carmel, and then select is just the Mount Carmel network overall. What we're expecting for next year is to be very competitive again on the select network. We've noticed that that has been a system that's done very well for us. It's well recognized in the area. And then what we're trying to do next year, and it should work out this way, where we've reduced some of the difference between the price of the select and the choice. So we're hoping for slightly closer pricing there and choice. We saw quite a few members with families move over, and some newer members also move over to have that Mount Carmel and Children's Network and Cleveland Clinic as well. So happy to speak on what the use cases are there as well. But overall, just again, adding options for members there. You will also see specifically in the plan design on the SBC, it will say select or choice. So there are more options on the select side in terms of plans, and then there's slightly fewer on the choice side, just given the pricing. We were a little bit more calculated with the plans that we offer on that choice network. I wanted to touch on Oscar app and account creation, just because this is actually a really important factor and something that we think is important. Member engagement really matters. Firstly, they're much more likely to refer their health plan and a broker. We've noticed that substantially over the last few years. They're also a stickier book too, so they tend to keep their renewal, they keep their health insurance, and that makes sense, right? They probably get much more used to maybe their plan design, their hospital, their network, but they also get used to, so, for example, the care team that takes care of them as well. They understand how to reach out to their carrier if something goes wrong or they have questions. There's kind of no confusion as to what their next steps are. In addition to that as well, having even just the online account, they have very similar functionality as they have on the app. Of course, paying bills, seeing claims is one thing. They can also search for doctors and drugs. It doesn't even require a login. I think it's one of the easiest workflows I've seen. And that drug search is particularly interesting too. And of course, brokers have access to this as well, where you can search the drug. It'll tell you what formula it is. And even if you select the plan, if you're shopping around or your existing one, it gives you a cost estimate on what that is as well. So kind of a nice, really neat, quick and easy prescription finding there. And then of course, you can also request virtual urgent care from the website. Again, similar functionality in the app itself, searching doctors, drugs, all of that. One of the things that I really like is firstly being able to renew prescriptions on the app is massive. I also like the save doctors feature as well. It's quite simple, but just having either my usual doctor saved, I use this a lot, or even potential doctors. Like I know I want to use a dermatologist in the next couple months, so I looked around for one. I don't need to go right now, but I saved it for future reference. And I've kind of done that with a number of doctors, so I have them on hand. So just great functionality that members can have something on the fly. I wanted to also touch on virtual urgent care now. Everyone's speaking about virtual urgent care now, given the pandemic. This is something that we've had for the last few years. It's a Oscar built app, so it's, we've designed our app with our own engineers. The same goes for our virtual urgent care. In most cases, they're actually speaking to an Oscar doctor as well. And essentially, it's unlimited 24/7 and $0 on all plans, with the exception, of course, of HSA and catastrophic. And it's great for getting in touch with a doctor in as little as 15 minutes for kind of those fairly simple urgent care needs. So we have the example here, UTIs, sore throats. I had a colleague who used it when their child came home and had pink eye, and they had the prescription within an hour, because you can select your pharmacy through that method as well. So just a really seamless, great option that I myself have used numerous times, rather than having to get out of the house or leave the office and try find care that way. And then there's also the care team as well. So that care team's based in Tempe, Arizona. They get paired with a team of care guides. There's registered nurses on file as well. And then we have services in English and Spanish. There's also translation services, should they require them as well. Wanted to kind of finalize on sort of 2 points. The one is that pharmacy aspect. So again, I mentioned in passing that we created our own formulary. So this is a substantial thing, but one of the reasons we did that is we really wanted to see how can we drive cost savings for members, and make sure that they're getting the most sort of appropriate care. Now, you can't just build out your own formulary. The vast majority of carriers will usually just kind of take one of the options that are given to them by a CVS or Walgreens or something like that. So when we built it out, it had to get approved by state and federal regulators each year. So it's a continuing process for us. We also have to update it monthly to ensure that members have access to newly approved drugs throughout the year if applicable. What this formulary, however, allowed us to do was introduce two things which I think are really, really significant, and I think they're a big part of why we became so popular over the last year or so. The first one is Tier 1 drugs are $0 when ordered through the virtual urgent care facility. So we have virtual primary care in some states. It's not applicable for Ohio, but for the virtual urgent care, if you utilize that doctor, and they usually will try to steer, if applicable, members to a Tier 1 drug, those are at $0. So pretty substantial there, and just a great day one benefit. The other thing that is almost better is a $3 prescription rate, or a $3 prescription list, should I say. And sort of what does that look like? So this is sort of our Tier 1A prescription list. You'll see that in the plan design. So there's sort of a dual tier on Tier 1. And the reason why we built this out is obviously cost savings, but we actually looked at member data, we looked at claims, we looked at existing conditions, and basically identified that over 80% of our members had either been already prescribed one of these drugs or could possibly switch to a Tier 1A drug. And this, when you think Tier 1A, they're often, very limited. This is nearly 100 drugs, almost 300 variations. There's even branded insulins included in that. So pretty substantial offering. Again, this is not subject to deductible on essentially all the plans, with the exception of catastrophic for the most part. And there's no confusion about it either. You kind of know going in that almost all the plans are going to have this $3 Tier 1A list, and what that list is. And then sometimes that even goes down to a $0 benefit for members that get enhanced subsidies as well. So I think this is a really great sort of member first benefit that only we have been able to offer thus far, because we took the effort to build out that formulary. And then I just wanted to touch on the diabetes plan. So this was, again, something that we launched trying to be a little bit more mindful of what are we seeing in the market, what are we seeing as prevalent. And diabetes is essentially one of, if not the most common issues that we see with many of the membership throughout the country. So we built a plan design with with that member in mind. So again, some of the benefits at a key level here, and again, this also isn't for diabetics exclusively, but it really is built for members that are actively managing chronic diabetes. So the plan benefits at a sort of high level are $0 eye and foot exams. There's $0 diabetic labs as well. There's $0 PCP visits, which I think is massive. As we know, they generally tend to need more checkups, and should be utilizing more checkups as well. And then we also introduced an out-of-pocket cap for insulin. So I mentioned there's branded insulins in tier 1A, obviously at $3, but for some members, as we know, they need to take one of these more expensive insulin options, and some of them can be substantially expensive. And so now we have that cap at $100 a month for those. In addition to that, we don't only treat the sort of symptoms, but try to having lifestyle management through Livongo is a massive part of it. So once members join this plan, they can then enroll in Livongo, and essentially it allows them glucose meters, strips, lancets, also personalized coaching as well. Perhaps they've actually never had help through this process as well. So that's a pretty substantial list of benefits that they're able to have. I couldn't even put it all on here as well. And again, lots of prescribed audit services are available too that generally tend to be free or at low cost as well. And again, just kind of quick top of the mind tips for selling the diabetes plan is obviously discerning whether they have diabetes, either from the medication, they obviously might not always tell you, but also finding out, what is the insulin that there are, checking the formulary to see what that is. And then also seeing, do they have chronic illnesses that maybe are linked? Something like that $0 PCP could really save them money in the long term as well. And then go ahead and compare the insulin costs for Oscar relative to other carriers to find the best access. There might be cases where this diabetes plan doesn't work for the member, but that $3 tier 1A drug list does, because that's the insulin that they take. So just a couple things that we've seen and heard from the market around some of the brokers that have done really well selling this diabetes plan. So that's all that I had prepared. Thank you so much. If you do have questions, please feel free, as Geoff mentioned, to add them to the question box. We'll also take down my email for any sales related questions that you might have. And again, thank you so much for your time.
Great, thank you, Jared. And let's open it up with some questions. Okay. By all means, if you have a question, put it in the question box, and we'll roll through these. First question is, what counties are you selling in Ohio?
Oh, wow, lots and lots. So
are you able
I'll
to
actually
name them off?
Yeah, so for Northeast Ohio, let me actually just share my screen here. It's just easier than me saying it. So those are all the counties. You'll remember that we added Stark, Tuscan, Wayne 2 years ago. So that's kind of the most recent addition, but essentially all of that sort of Cleveland metro area, Akron metro, we sort of cover all of that all the way down to sort of New Philadelphia, and that's a small town area there as well. So that's the Northeast network. So that's just Cleveland Clinic plus Oscar. So no massive adjustments there. And then in Columbus, Delaware, Fairfield, Franklin, Licking, Madison, Perry, Stark, and Union. So that's, and you'll see obviously there's a slight overlap. There's Stark in both. That's largely just around how the rating areas have been built out.
And I noticed on that slide, you do have Nationwide Children's, and that's a huge addition. I didn't see it listed on that hospital, but I believe that's in Central Columbus. Is that right?
Yes, that's Central Columbus, one of the premier children's hospitals in the country. That is part of the Choice network. So that's the broader option of the two. The Mount Carmel being the lower end, and then Choice being part of that. And then actually just touching on that too, people have asked us, why did we split out the networks? One of the big reasons is children's networks or hospitals tend to be incredibly expensive. The care, as many of you folks understand, is incredibly nuanced and very, very expensive. By splitting out these two, not only were we able to add Cleveland Clinic Hospital, but for members that are more price sensitive, that don't require something like Nationwide Children's, we're now able to offer a really competitive select option with Mount Carmel, and then for those folks that need it, that slight bridge up with Choice, but added with the Cleveland Clinic as well for more kind of specialized care needs.
Okay, great. Thanks for the clarification. And here's another network question. The Columbus Choice Network includes the Cleveland Clinic. Does it include the Cleveland Clinic in Northeast Ohio? So kind of go into that if you wouldn't mind.
Yeah, absolutely. Yeah, so that Cleveland Clinic Foundation, they really only have hospitals in that sort of northeast area. So the way to think about it is, and how many of our brokers have told us based on what their members are telling them, is that choice network is kind of for there's sort of two scenarios where it makes the most sense. The one of which is for members that are existing Nationwide Children's Hospital, or they have kids and they want that at their disposal should something happen, or perhaps they're already using it. That's the one scenario. The other scenario is they're willing to pay a little bit more to have Cleveland Clinic and network. However, knowing that they kind of day-to-day cases, they'll use Mount Carmel, but due to the distance, they have Cleveland Clinic there for maybe specialized urgent care, most of the time elective surgeries. Let's say if someone knows that they want something done and they prefer to have access to Cleveland Clinic given their reputation, they now have that as an option. So those are kind of the two scenarios which make sense for that choice network.
Okay. Great. It's about 7 after. We'll be wrapping up here in a few minutes, but just a few more questions. Will we receive a copy of the presentation? Absolutely. It's being recorded, and we should have this sent out to everybody sometime later today. And next question is there anything in Northwest Ohio?
No, not just yet. Again, it's whenever we look into a new area, there has to be a few things. Firstly, there has to be an identification of essentially, do we deserve to be there? Is there a need in the area? That's the first thing. The second thing is, how does it work with existing partners? So like if we were in Northwest Ohio, once you start looking at those rating areas, you might have to join that all the way up into Cleveland as well. That's at least based on what we've seen initially. So that's the one thing. And then the other thing is, do network partners even want to work with us there? So those are kind of three really important factors that go into any introduction to a new county. And so Western Ohio, sort of Toledo area, has not really come up as matching all three of those just yet. But again, never say never. And we are looking to have some expansion in Ohio in the next 2 years or so. We just aren't sure where just yet.
Okay. A couple more questions. Just want to confirm. So yes, is the Columbus Choice Network, does it include the Cleveland Clinic main campus in Cleveland?
Yes, it includes all of that Cleveland Clinic sort of infrastructure. Main campus, there's smaller centers, that's all included. We don't pass out anything from it. And again, that's just because we do have that joint venture with them, so it's not a network discussion. It was basically they're either in the network or they're out of the network. And so now that they're in, members will have that full access to Cleveland Clinic. So if they want to go to main campus, for whatever reason, they can go there.
One comment was, can we request contracting? Absolutely. Send me an email. I'll get that started right away for you. And this will be the last question. Is COPC, this is the Central Ohio Primary Care, is this going to be in network?
I have not heard of that practice before, to be honest. If you give me a second, I can actually look it up if you'd like me to. Give me 1 second.
Okay.
I can do that. Also a bit of an example of how fast the search tool used, because I honestly sometimes use the public facing one anyway.
Yeah.
And
sorry,
actually on that,
I can't view it, or probably that bandwidth will probably close out.
no problem. Just give me a minute or two. I don't believe so, but let me just triple check here. And I'm much more of the mindset of rather no than say maybe.
Yeah. And his comment is they have 380 primary doctors, so apparently it's a big one.
Yeah, oh yeah, for sure. That does something that makes sense.
Maybe they have a separate contract. I'm not sure what hospital they're affiliated with.
I don't see them included. If this is sort of a deal breaker for you folks, do let me know. Haven't frankly run into an issue of primary care in the Columbus area personally, just because I actually think that Mount Carmel tend to kind of focus a lot around that. But with that being said, I'm always open to more feedback, and if you think that is important, please send me an email, and I'll actually we add providers all the time, provider groups. If it's something that is important and they're willing to speak with us, then that's something that we will definitely look at.
Great. Well, fantastic. We really appreciate you having joined us today. Everybody will get a copy of the presentation. And with that, we'll conclude the presentation. Thank you, everybody.
Thank you, everyone. Bye-bye.